Have you ever wondered if you're ready for bunion or hammer toe surgery? Or have you ever thought about what the doctor's criteria is to determine if you're ready for that procedure? Keep watching this video for answers. Welcome to Suite 250 at Cool Springs Foot Care. My name is Dr. Lance Reeves, and today I'm going to talk about different criteria that I use to determine if patients are ready for bunion or hammer toe surgery. The first question I ask patients is, are you in pain? Pain is the number one factor to me of when a patient could be ready for bunion or hammer toe surgery. The follow-up question to that is, how often are you having pain? If you're only having pain every once in a while in a certain pair of shoes, I'm probably going to recommend you get rid of that pair of shoes. But if someone is having pain throughout their entire day, that's a big problem. Nobody should be living in constant pain due to their painful bunion or hammer toe. So my first criteria to determine if someone is ready for bunion or hammer toe surgery is, are you in pain all the time? The second part of my criteria is to determine if this is interfering with a patient's daily activities or the hobbies that they love. Again, if this is just bothering you with certain activities at certain times that's not consistent, I'm going to try to work with you to see if you can avoid any type of surgical intervention. But if this pain is occurring all the time, meaning when you're walking to the mail, when you're at work, before work, after work, and it's hurting you all day, that's a big problem. To follow that, if your pain is constant when you're doing the hobby you love, that's also a big problem. If you're an avid pickleball player and this is preventing you from playing the sport you love, then we may need to work harder to get you back onto the court. Nobody's painful bunion or hammer toe should prevent them from playing the sport they love. So my second criteria for determining if someone is ready for bunion or hammer toe surgery is if this is interfering with daily activities or if this is preventing you from playing the sport you love or the hobby you love. The third part of my criteria is to determine what all a patient has tried conservatively before starting to discuss the surgical option. If one of my patients has not tried new shoes, they've not tried inserts, they haven't tried rice therapy or a physical therapy program, then to me they're not a good surgical candidate. I feel a patient should try as much as they can before they start to look at surgical intervention. So if a patient has tried shoes, orthotics, rice therapy, physical therapy, and there's still no improvement in their pain, then yes, that patient may be a good candidate for surgery. Exhausting all conservative measures to me is a good sign that that patient is ready to move forward for a more invasive option to help correct their bunion or hammer toe. So my third criteria to determine if someone is ready for bunion or hammer toe surgery is if they've tried and failed a lot of different conservative measures. All that being said, if you are in pain all the time, if this is interfering with your daily activities or preventing you from the hobbies you love, and you've exhausted all conservative measures, I do think you could be a great surgical candidate for bunion or hammer toe surgery. If this sounds like you're in this situation where your bunion or hammer toe is causing pain all the time, interfering with your activities, or preventing you from playing the sports you love, and you've exhausted all conservative measures, please give us a call. I would love to sit down with you and talk through your different options for your bunion or hammer toe. You could call our office at 615-567-5622, or you could visit us online at www.coolspringsfootcare.com. Thanks so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.